So my name is Matt McNaughton, MD. I am a psychiatrist working on an inpatient psychiatric unit just outside of Salt Lake City, Utah. As part of my daily job responsibilities, it involves conducting interviews with patients, adjusting medications, and just overall working to help them to get to doing a little bit better than they are when they come in. As a psychiatrist, I have a medical degree. I'm an MD, so I've completed medical school, I've completed general medical training in residency, and because of that, a lot of what I do in my day-to-day life focuses more on medications and the medical side of things. A therapist is going to focus more on kind of working through problems, developing coping skills, talking through and processing through things. But psychiatrist is unique in their ability to prescribe and use medications. I think back in the day, and especially among older people, you have this misconception that only crazy people need to see a psychiatrist. And that's not true at all. Especially outside of the hospital, you're dealing with a lot of people that are totally normal, that might have good jobs, doctors, lawyers, CEOs, things like that are just dealing with some problem that needs help. Another thing that's kind of a newer misconception that I notice a lot in younger people is this idea that medications and mental health treatment is going to fix every problem. So unfortunately, we don't have, a magic happy pill, anything like that. There are a lot of things that go into the treatment of depression or the treatment of anxiety, therapy, coping skills. Medications can be really helpful. It can be like throwing someone a life preserver. So when life gets rough, you have something to keep your head above water, keep you going to work, keep you spending time with your friends, keep you doing the things that are important to keep you sane. But there still is a lot of other work that goes in, and nothing that I can do in a lot of situations like depression and anxiety is going to be a quick fix. It kind of depends on a day-to-day basis. For the most challenging part of the job, there's a lot of really heavy stuff that you see or that you talk to people about in mental health in general. So you can end up talking about some really dark things with people or kind of re-experiencing people's darkest moments. Eventually, you can kind of get a little bit desensitized to that, so it becomes easier the more that you deal with it. So the other thing that can be really difficult is whenever you're kind of trying to help someone that's just in a really bad situation. Like if somebody comes in and they're depressed because, they're broke or they're homeless or, they have a really terrible family situation, something like that I can't really help with. Those can be a lot more difficult because there's, only so much you can do, and that it's going to take a lot more time and a lot more interventions than you're able to deal with to actually kind of help people. In Piaget's theory of cognitive development, it usually ends by about age 12, age 11, kind of the transition from childhood into puberty or adolescence. So by the time people come to me, since I usually work with adults, whatever Piaget is talking about or thinking about has usually already happened. For me, it's more important whenever things go wrong. For example, if somebody has a type of intellectual delay where for whatever reason they're not as far along that development as they should be by an adult, that's something that's important to make a note of. If you're working in child psychology, which I have a little bit of experience with, it becomes a lot more important, especially whenever you're dealing with like behavioral problems or things like that. I mean, just one example that's not related to medicine or psychology would be like if you're developing a school curriculum, understanding that kids of a certain age are, you're not going to be able to teach a third grader philosophy or something like that, just because the ability to think in abstract terms about ethics and morals and to think outside of themselves is just something that typically a third grader isn't even able to begin to comprehend. And this can come to play in legal perspectives or, whenever I'm dealing with my job, if we have a patient who's a 30-year-old but had a traumatic brain injury or, is profoundly autistic or something like that, where they haven't developed to where they're supposed to, it becomes a little bit easier to empathize with or to deal with or to prepare for them having behavioral problems, picking fights with people, yelling at people, because it's easier to understand that all of those developmental faculties that somebody would normally have aren't there. Another time you can see that is in like dementias and situations where people for whatever reason are regressing. So as you get older and your brain kind of deteriorates a little bit, some of those things that you've learned or developed over your life become more difficult.
Cognitive development and moral development have a lot of overlap, but they're not really the same thing. Piaget has some theories of moral development, and there's another psychologist whose name is Kohlberg, who also has a bunch of different theories of moral development. And these kind of go along with those cognitive stages. For example, whenever you're in the earlier stages of Piaget's cognitive development, we talk about as being called like the sensory motor phase, where you're taking information in and you're interacting with things. So you think about a baby that's crawling around and touching things and putting them in their mouth, things like that. In this situation, your idea of morality and ethics and what's good and what you should and shouldn't do comes a lot from your understanding of like physical consequences, understanding that I don't want to knock things off of the kitchen table because then mom and dad will get mad at me. You're trying to avoid punishment and get rewards. Whereas whenever you get a little bit older and you're more able to understand abstract concepts like goodness or empathy or justice or those kinds of things, your understanding of morality becomes a lot more complex. You're able to kind of think outside of yourself or the situation or even like the people that are involved, and thinking kind of broader, absolute ethical principles and things like that. So one of the theories that I look at a lot, especially whenever we're talking about therapy or understanding people on a deeper level, it's the theories of Erik Erikson, who's an American psychologist who has this kind of lifelong, stepwise series of conflicts that people go through. So in early childhood, your main conflict could be, it's what's called trust versus mistrust. So you're trying to incorporate the knowledge that you can trust your parents to provide you with food or to meet your needs. And if you're able to do that, if you're able to develop that trust, then you can move on to the next stage without any major problems. But if you grow up in a neglectful family where your parents aren't feeding you, where you don't feel safe for whatever reason, then you move to the next stage, mistrustful. It's harder for you to interact with people, to open up, to build relationships, which can have lasting consequences. One that I see a lot is the stage called intimacy versus isolation, which happens in your mid-20s, late teens, 20s, early adulthood, where people are trying to build relationships, you're trying to meet people, trying to start families. And so I see a lot of people that struggle to do that, and they're kind of grappling with this conflict. And as you get older, there are other conflicts that you go through in old age. The final stage in Erikson's theory talks about ego integrity versus despair. So are you able to look back on your life and feel good about yourself and good about the things that you've done? Or is that something that makes you feel hopeless about life as you move on to, face your own mortality and things like that? I think sometimes people will think that, oh, if I just go to the doctor, they'll be able to fix me. Like if I had a heart attack or something, you go and you get heart surgery and it's done. And that's just not quite how things work a lot of the time in psychiatry. So most things that you can do in psychology in the mental health fields, you're going to need an advanced degree to do. Not everything, and sometimes, at least back in the day, and depending on states, you can just take tests and get a license to do some form of counseling or basic social work or things like that. But most of the time you're going to need to get your bachelor's degree, and then you're going to need to do either a master's or a PhD program if you want to be a counselor or a therapist. In addition to that, you're going to need to get X amount of clinical hours before you can start practicing. So for me, part of why I ended up doing psychiatry as opposed to psychology or getting a PhD or something like that is if you do go into this field, like I mentioned earlier, you have opportunities to kind of shape your practice however you want it to be. So if you wanted to just do therapy as a psychiatrist, you definitely can. A lot of people don't. You're probably leaving some money on the board or something like that. But you have those opportunities to be flexible in what you do and kind of how it all works out. So I think it's all valuable. I have at my current place of employment, we have a lot of therapists that work there, and they're awesome, and having them around to help us out to really do deep dives into the therapy and working with the patients in that way is super helpful. So I think all of them are valuable, things to pursue.